Hello guys, welcome back to my channel Anytime Medicine, and today we are going to talk about purine metabolism associated drugs and disease. In my last video we have seen that purine metabolism and its three parts like synthesis, salvaging and degradation. Today we are going to see drugs and disease that are related to each of those parts. The first part is the purine synthesis, and rate limiting step for purine synthesis is IMPDH, which converts the IMP into the XMP, which is xanthinosin monophosphate, with the help of NAD plus and H2O. You can see the IMP and XMP structure below. That is converting the IMP into the XMP. Only difference is the one added oxygen into the XMP structure. Further, we talk about rate limiting step. The XMP will convert into the GMP with help of glutamine. So IMPDH is a rate limiting step for GMP synthesis, therefore regulatory step for DNA synthesis. If we don't have enough guanine, then we cannot make the DNA. The first drug we are going to talk about is Ribavirin, which is antiviral drug which inhibits the IMPDH. So it will block the conversion of GMP from IMP, and that will inhibit the synthesis of guanine nucleotides, which are purines. And there will be less purine for virus to replicate themselves in the host body. So that's how we can slow down the infection of certain viruses. The second drug we are going to talk about is mycophenolate, and which is immunosuppressant. T cells and B cells are very important for the immune response in the body. Sometimes T cells and B cells override the immune system and will create the autoimmune diseases. Mycophenolate inhibits the IMPDH in white cells, so there will be less guanine in T cells and B cells to replicate, therefore less T and B cells immune response and immune system will be suppressed. It is used in organ transplant like kidney transplant. It will prevent the recipient's immune system to attack transplanted organ. The second part is purine salvage, in specific hypoxanthine and guanine. Hypoxanthine and guanine will convert back into IMP and GMP respectively, interacting with the PRPP, an enzyme called HGPRT, which is hypoxanthine guanine phosphoribosyl transferase. Here you can see the reaction that hypoxanthine and guanine is interacting with the PRPP and HGPRT and making IMP and GMP. The other drugs we are going to see are 6-MP and Azathioprine. The first one is 6-MP, that is stands for 6-mercaptopurine. Is a chemotherapeutic agent that mimics the structure of hypoxanthine and guanine and competes for enzyme HGPRT because they have similar structures. On your right you can see the 6-MP structure, it has sulfur in it, and on your left you can see the hypoxanthine structure that is have oxygen in it. The 6-MP will react to PRPP and HGPRT and will make thioinosinic acid, and this thioinosinic acid will stop the whole salvaging process. This inhibits the multiple steps of de novo synthesis of purine synthesis. This will decrease the production of IMP, AMP and GMP, and it is used as treatment for certain cancers like acute lymphocytic leukemia, chronic myeloid leukemia, Crohn's disease and ulcerative colitis. The second is Azathioprine, is also an immunosuppressant which will metabolize into the 6-MP, and the same series of reaction will occur and will decrease the production of IMP, AMP and GMP also. It is used in organ transplantation, rheumatoid arthritis and inflammatory bowel diseases. The third part of purine synthesis is purine breakdown. Purine breakdowns into uric acid and will be excreted from the body. The hypoxanthine and guanine will convert into the xanthine with the help of enzyme called xanthine oxidase and guanase, like we have talked about in my previous video. Further to it, now xanthine will become uric acid with the help of xanthine oxidase. Xanthine oxidase is a very important enzyme for the purine breakdown. If we don't have xanthine oxidase, we can develop certain diseases that we will going to talk about in this video later on. In case of adenine, adenine will have to convert back into the nucleotide and then breakdown will occur. Adenine will convert into the AMP with the enzyme of APRT, which stands for adenine phosphoribosyl transferase. Then AMP will convert into the adenosine, and adenosine will convert into the inosine with the enzyme of inosine deaminase. Inosine will convert into the hypoxanthine with the enzyme of purine nucleotide phosphorylase. Now we'll see adenosine deaminase deficiency, which is ADA deficiency. ADA required for degradation of adenosine and deoxyadenosine, which is DATP. So if we have less ADA, then we will have more DATP. So there will be decreased ribonucleotide reductase activity too. If we have more DATP, that will give negative feedback to this enzyme, and that will decrease itself too. That will lead to lymphotoxicity, and this is also major cause of SCID, which is severe combined immunodeficiency. The other disease is gout. Occurs when there is excess uric acid in plasma. There will be crystal deposition in joints, and that will lead to pain, swelling and redness. Can occur when there will be under excretion of uric acid, patient with diuretics like furosemide, or can occur from overproduction of uric acid via purine pathway. Patients which have trauma and which have high doses of chemotherapy will have lots of purines into the plasma, because while trauma we lose so much purine in plasma, and chemotherapy there is inhibition of purine synthesis, so we will have lots of purine in plasma and they will break down them into the uric acid. Further, if we consume high amount of purine rich food like meat and seafood, we can most likely to develop gout. Allopurinol is a drug which help in gout, which inhibits xanthine oxidase. We have to be cautious in using this drug while using with 6-MP and azathioprine, because they metabolize by xanthine oxidase and make thiouric acid, which is inactive form of uric acid. So there will be high level of 6-MP and azathioprine. They may boost effect of 6-MP, but they can cause toxicity too. This combination can use intentionally in some cancer and cancer patients. That will boost the effect of 6-MP and azathioprine. So this is the common location for gout, and you can see the crystallization of uric acid at the joint in a foot, and you can also see the redness of the area. The last disorder we are going to talk about is Lesch-Nyhan Syndrome, which is X-linked disorder, occurs only in boys in which children are born with absence of HGPRT. In absence of HGPRT, we cannot convert hypoxanthine and guanine into the XMP and GMP, so there will be more hypoxanthine and guanine, and there is also excess of uric acid production because of the excess hypoxanthine and guanine, and they will go to purine breakdown pathway and will create more uric acid, and this is called juvenile gout too, because occurs only in children. So excess de novo purine synthesis will ramps up because not able to salvage purine, so there will be excess PRPP and IMP. There will be neurological impairment, and this mechanism is unclear. How the neurological impairment occurs. The neurological impairment are hypotonia and chorea. The classic feature of the neurological impairment is self-mutilating behavior like self-biting and self-scratching. Sadly, there is no treatment available for this syndrome. Here you can see the pictures of self-biting fingers and lips. This is the classic pictures of self-biting of fingers and self-biting of lips. Thank you everyone for watching this video. Subscribe my channel, share it to your friends, and see you until next.